Hey guys, Dr. Kelsey here. Welcome to my YouTube channel. I wanted to put this video together because right now I've been seeing so many patients who are just congested, they have stuffy noses, they're coughing, they're feeling low energy. It is cold and flu season at the max. Obviously being a naturopathic doctor with all of my patients, I'm really trying to support them foundationally with making sure they're well hydrated, making sure they're getting enough rest, making sure that they're eating really nutrient dense foods. But sometimes with our culture being what it is and the hustle and bustle of everyday life, sometimes that's just not enough. So I'm putting this video together to talk about 5 of my favorite kind of go-to top shelf remedies for the winter season. These are ones that I use personally myself. These are ones that I recommend to many of my patients, and they're pretty much all backed by good science and clinical evidence is being really effective. So without further ado, the first one that I would like to introduce you to is elderberry. So most people have heard of elderberry if they've been using natural healthcare methods in some way. It has long been renowned for its antiviral effects. There was a couple studies that came out, one in 1994, one in 2005, that showed that a juice concentrate of elderberry was incredibly effective at battling both influenza A and B. However, in the last few years, we've actually broadened our understanding of it, and now we're seeing that it has antibacterial effects as well. There was actually a study that just came out last month in October that showed, it was looking at the antioxidant effects of some of the constituents, the proanthocyanidins in here on the cellular membrane of humans as well as the cellular membrane of tumors. And what it was showing is that it had COX-1 and COX-2 inhibition activity, which is kind of similar to how aspirin works. It's a big anti-inflammation and anti-pain pathway. And that it also was showing some promising effects at being anti-tumor. So that's really impressive. I would say that elderberry is the most effective when it's used as a preventative measure. A lot of my patients will pick up an elderberry syrup at a natural food store, and that's great. You can use that in place of a cough syrup. It's great kind of in that acute phase when you're sick. You can use it for cough, for colds, for sore throats, for losing your voice. But for preventative maintenance, I really like to use an elderberry concentrate. This is the one that I carry in my office. There's nothing in here. There's no preservatives. There's no added sugar. That's why I like it as far as more of a long-term treatment because you're not getting that extra dose of sugar. It is actually more cost-effective long-term since it hasn't had to be concentrated down into a sugary syrup. This is something that I recommend to all of my patients who know that every winter when it comes, they're going to either be getting bronchitis or the colds or the flus. So anybody who's really exposed often knows that they have a tendency to get sick. This is my go-to for them. It's a great product. People really love it. I have a hard time keeping it on my shelves because people love it so much, but awesome, awesome product. My second one that I would go with is vitamin C. You can't forget vitamin C when you're talking about immune health. So vitamin C has been known for a long, long time at being really promoting to the immune system's strength. We actually have a lot of research on vitamin C showing that in really high doses, at doses that you would typically get in IV administration, that it actually induces apoptosis of unhealthy cells. Apoptosis is the programmed cell death, which basically tells a cell that is not beneficial to the body anymore, that it needs to recycle itself out of the system. So as I said, it's used in IV treatment for cancer patients because it actually causes apoptosis in cancer cells. Besides that, vitamin C is also a mast cell stabilizer. So mast cells are these cells in your body that contain histamine. Most people think of histamine with allergies, but it's an inflammatory molecule that when the mast cell bursts open, the histamine can go all over the body and create that inflammatory reaction that causes the itchy, watery eyes during allergy season, but can also cause any kind of inflammation in the body. Vitamin C goes in the body and it actually keeps those mast cells from bursting open so that the histamine can't go all over the place. So this is really great. Most vitamin C that you can get over the counter, I think, some of the highest that I see on the store shelves is about 1,000 milligrams. That's your typical emergency packet. A lot of the typical capsules that you might find off the shelf at a Whole Foods or natural grocers. This one that I carry, I really like it because it's a powder. It's really easy to dissolve in water, and one little scoop is actually 4,000 milligrams. So it's way stronger, and I really feel like you can get a nice bulk dose of it that way. Most people can actually tolerate a much higher amount of vitamin C than they can typically get from what they would buy off the shelves. We do have specific dosing recommendations on this, so it's something I would definitely recommend talking to somebody about before you just go hog wild on it, but vitamin C. All right, number 3. So there's a company called Wish Garden Herbs. Wish Garden Herbs is out of Louisville, Colorado, and so being local to me, I'm a big supporter of them. I love the way that they practice. They really formulate their remedies in the wise woman tradition, and they make all of their tinctures by like very foundational standards. So they're one little shop in Louisville that manages to make these amazing products that they send all over the country. I've gone there a couple times with my students. I do teach part-time for those of you who are new to this channel, but my students and I have gone and toured there every year, and I'm always just so impressed with their knowledge and how much care they put into their formulas. This one in particular is called Kick-Ass Immune. It is amazing. This is the one that I always give to patients no matter what's going on. It's really designed to be used at the onset of symptoms. So it's not so much preventative, and it's not so much, oh, I've already been sick for 3 or 4 days. This is, oh, I'm feeling something maybe today. And this one is amazing. It's formulated to go in there to really boost the immune system. You can dose it pretty often. I would usually follow the recommendation from Wish Garden actually. But I find that this one can really kick a cold out before it gets settled if you get on it fast. And I also find that it doesn't taste too bad either, which is not something you can say of all tinctures. I often will formulate tinctures for my patients myself, but this is a great go-to. One that you can buy on the market and one that I always keep in stock in my office. All right, so number 4. Number 4 is actually a duo, and I'm actually out of one of them because of how popular it is, but I have 2 of them here today. So one of the companies I work with is named Orthomolecular Products. Orthomolecular is a physician-only brand, which means that they only sell their products through healthcare professionals. And the reason they do this is because by doing that, they are able to maintain the integrity of not just the industry, but their company, their products. They put a lot of money into research and have really great quality assurance standards, and they're only able to do that by keeping it a physician-line brand. So 2 of the products that I like to use from them during the winter season is one, Viracid. The other one is called Whole Immune, which I don't have right now. But the Whole Immune is really designed as a preventative. It's kind of like my elderberry. It's for people who know that they tend to get sick every year, and they kind of take it one a day all year long, and it just prevents that cold and flu from happening. One of the main ingredients in that product is a beta-glucan, and beta-glucans basically stimulate, or they recruit your lymphocytes to make more neutrophils. Neutrophils are one of our white blood cells, and they're basically the first responders whenever we have a threat to our immune system. So they come in and they battle whatever is going on right away. By making more of these little soldiers and having them ready to go, when the body does perceive a threat like a virus or bacteria, it's able to tackle that much more quickly. So it's a great product. This one, Viracid, kind of goes alongside it. Viracid is more for the acute attack. So let's say the bacteria or the virus gets past those initial defenses and we start feeling sick. This is meant to be taken fairly often for about a 12-hour period. It's designed with a lot of nutrients and various botanicals in here that really pack a punch as far as boosting the immune system. And this is another great go-to that if you take it right at onset can really kick the cold out or shorten the duration of it if you just barely started a little bit too late. So love those products. I've had a lot of great success from that company. I use a lot of their products and my patients love them. All right, so last but not least, one of the things that I'm just super intrigued about right now, it's become my new muse almost, would be medicinal mushrooms. The more that I learn about them, the more fascinated I am. Mushrooms in general have had a pretty well-documented history of being immune modulating. and anti-cancer in effect. They're incredibly safe, so they're good to take in large doses, long term. But every mushroom has a little bit of a difference in its profile. So some of the ones that I like to use, these are just a couple of the ones that I carry in my office. So Host Defense is the brand that I really like. Host Defense was designed by a man named Paul Stamets, who's a major scientist and multi-decade mushroom researcher. Um, and what we found is that this mushroom in particular, agarikon, besides being immune boosting and potentially having those anti-cancer effects, is actually very antiviral. There was a study done on it recently that looked at its effect against tuberculosis and showed it to actually be fairly effective, which is incredible. And then Paul Stamets also talks about its use against viruses like the herpes simplex virus, the human papilloma virus, and as well as influenza virus. I've personally been using this one over the last few months just to test it out, and this is the first year that I have not caught the cold that my patients and my students seem to pass around every fall. So I'm a big fan of this one. My household's staying very healthy using this, and it's not a huge dose either. So I love these products. All right, so that kind of encompasses 5, maybe 6, I guess, of my top cold remedies. Obviously, the way that I treat my patients is completely individualized. So while these might work for you, they also may not be the best choice. So if you have questions about this, please feel free to post them below or schedule an appointment to speak with me so that we can figure out what might be best for you this cold and flu season. All right, that's it for me. I'm out today. Have a happy winter.